3.
Okay, so we have our community group project today on HIV. This is presented by Katrina Guevara, Emily Polinsky, and Isabel Ruiz. So HIV, there are currently 38 million people in the world that are living with HIV. It is transmitted through several ways, such as unprotected sex, sharing of IV needles, from the mother to fetus, and from the mother to baby during breastfeeding. It is also transmitted through blood transfusions, but that is more on a rare occasion. In the 90s, when HIV began, life expectancy was anticipated to be between 28 and 30 years old. But now with treatment, the virus can be under control within 6 months, and the life expectancy now is almost the same as someone without the virus. So as far as the pathophysiology and stages of HIV, it is a retrovirus that causes damage to the immune system. There are 3 stages of HIV. The first is acute infection, where there is a large amount of HIV in the blood and it is very contagious. Many people have flu-like symptoms or they don't have any symptoms at all. The second stage is chronic infection, where HIV is still active but at lower levels. HIV can still be transmitted during this stage, and this stage is the longest. It can last a decade or longer. The third stage is acquired immunodeficiency syndrome, or AIDS, which is the most severe. That is where the CD4 lymphocytes are under 200 cells per millimeter. Without treatment of the AIDS stage, the third stage, life expectancy is about 3 years. So the objectives for a community with limited resources, the main one is access to healthcare. As far as prevention, people don't have access to condoms, clean needles, prenatal care if they're HIV positive and pregnant, or education regarding breastfeeding while being HIV positive. Another access to healthcare is the treatment itself. If they're positive, treatment is needed to suppress the virus and keep them healthy. And then testing, access to tests so that people can find out their status. Up to 19% of positive cases, these people are unaware that they are positive, which leads to more spreading. Community support, children can become orphans if losing parents or guardians to AIDS. Also, sometimes people have the inability to cope, which can cause some to lead to drug use, job loss, homelessness, etc. And proper education. Education on prevention and treatment of the virus is another objective, and an increasing rate at which patients give full disclosure. So that's going to be people that are aware of their status and tell their partners or somebody that they're sharing a needle with that they do in fact have the virus.
Okay, so prevalence of HIV in the US. This is a map from the CDC with data from 2018. It shows the average number of people per 100,000 in each state that are living with diagnosed HIV. In California, there are 395.9 per 100,000 population. In total in the US, there are 1,040,352 adults and adolescents living with diagnosed HIV. Of those, 75% are male, 24% are female, and the last 1% are transgender. Persons aged 50 to 54 made up the largest age group living with diagnosed HIV at 15%. And then broken down even further by race and ethnicity, 41% are Black or African American, 29% are white, 1.5% are Asian, 0.3% are American Indian or Alaska Native, 0.08% are Native Hawaiian or other Pacific Islander, and 4.6% are multiple races. Okay, so symptoms of HIV. This picture shows some of the symptoms of HIV. Those include night sweats, mouth ulcers, fatigue, chills, muscle aches, rash, fever, and swollen lymph nodes. Some people have flu-like symptoms within 2 to 4 weeks after infection. This is called acute HIV infection, and it may last for a few days or several weeks. When people don't seek treatment, they progress through the 3 stages that Katrina talked about earlier. In the acute stage, people may have flu symptoms or no symptoms at all. In the second chronic stage, people may not have symptoms or even get sick. In the third stage, which is acquired immunodeficiency syndrome, or AIDS. People have such badly damaged immune systems that they can also get severe illnesses called opportunistic infections. Symptoms of AIDS include rapid weight loss, recurring fever, night sweats, unexplained tiredness, sores of the mouth, anus, or genitals, red, brown, purple, or pink blotches on or under the skin, in the mouth, nose, or eyelids, and neurological disorders. So this just shows what the rashes can look like on your skin, and then the different mouth ulcers that you can have. Okay, and risk factors and prevention. So the highest risk factor is anal sex. Other risk factors include vaginal sex, oral sex, injection drug use, substance abuse, and mothers can transmit HIV to their babies in pregnancy, childbirth, and breastfeeding. Sharing needles, syringes, or other equipment to inject drugs puts people at high risk for HIV. People that inject drugs actually account for about 1 in 10 HIV diagnoses in the US. So prevention of HIV includes using condoms correctly and every time you have sex, choosing lower risk sexual activities. You can take medication to prevent HIV, which is called PrEP, and that stands for pre-exposure prophylaxis. And there's also treatment if you already have it called ART, which stands for antiretroviral therapy. You can get tested and treated for other STDs, and there are also SSPs, which are syringe service programs, and they provide access to sterile syringes, services to help stop substance misuse, testing and linkage for treatment for HIV, and education for overdoses. And then pregnant women that live with HIV can prevent transmission to their babies through treatment with a combination of HIV medicines or ART, which was the antiretroviral therapy.
Okay, so here we have some health resources that you can go physically access to test if you have HIV or if you have any concerns that you have been exposed. A few listed are more local to the San Joaquin County, such as the Stockton Health Center, where you can get STD testing, which includes HIV testing, and family planning services. So for example, let's say you do have HIV and you are having a baby, they'll be able to go ahead and assist you in the right direction. You can also go to Planned Parenthood, which also has similar services such as STD testing, and you can go ahead and access syringe service programs where they basically exchange old dirty needles for clean ones. This can help reduce the risk of HIV by allowing people to have access to clean needles rather than reusing dirty ones. And then we also have just support groups and systems. There are a lot of online communities that have a lot of people who are positive for HIV that come together and they offer support for one another. They're available on Facebook, there's dating websites, and etc., so that you can find services. You could also talk to a counselor or therapist to help you cope if you do have HIV or were potentially exposed to it. Okay, so if you're exposed, the number one thing you should probably do is go to your primary care physician or clinic, and you need to test negative to start receiving prophylactic medication. So if you test negative, that means that you do not have the virus currently, and that means that if you take a preventative medication, that you're most likely to reduce your chance of getting HIV. It's very important that when you do start prophylaxis treatment that you do not miss any doses, because for every dose you miss, you are increasing the potential of having HIV. Also, when you start receiving treatment, you need to get retested every 3 months because it could be possible that HIV does develop. Just because you are taking prophylaxis medication does not mean that HIV won't develop at all. There's still a risk. So you need to get that evaluated every 3 months to see how and if this medication was effective at treating HIV. It's also really important that you let your provider know that if you're pregnant, if you're breastfeeding, if you have liver problems, kidney problems, or other STDs, because this can either mean that you're not a candidate for prophylaxis treatment, or it can still like higher your risk of HIV, meaning that the prophylaxis treatment will not be as effective. Okay, so as Emily kind of went over, we do have the PrEP, which is pre-exposure prophylaxis. It's a pill form and it's taken when you think that you will be exposed to HIV. You can go ahead and get it from your provider. It does require a prescription. Some side effects include nausea, loss of appetite, and a mild headache. If you take it as directed, it should reduce your risk of HIV infection by 92%. And it is usually covered by insurance. However, if you do not have insurance, there are other ways. Some examples of medications that you would be taking are the Descovy and the Truvada. And then we also have PEP, and this is kind of a preventative measure in the same way as PrEP. However, it's after you've had an HIV exposure. So PrEP is before and PEP is after, but they do deal with the same kind of medication, but a little bit different circumstances. Okay, so we do have medication assistance programs. A lot of these programs are actually offered by the manufacturer of the HIV drugs, whether it's for prophylaxis treatment or for actual antiretroviral therapy. You can use your insurance, so you can use your insurance and you can use these medication assistance programs to help lower the copay if your insurance does not cover it for whatever reason, or it can lower the overall cost of the prescription if you don't have insurance. But the number one key to accessing this medication through this program is that you have to have a prescription. For these specific medications, you would go through the Gilead Advancing Access Program. So diagnosing HIV, you can become positive for HIV about 3 weeks after exposure. And we would go ahead and test this using an antibody test, which you can take through blood or saliva, and nucleic acid test, otherwise known as NATs, which detect the viral load. So for example, if you did test positive for HIV, the nucleic acid test would go ahead and detect how much of that HIV virus is in that, and it would determine what phase you are or stage you are, as Katrina earlier stated, out of the 3 phases. Okay, so controlling HIV. So again, you can receive management through a primary care physician, or if you go and see a health clinic regularly, you can go through multiple providers who have your file and can give you proper treatment instead of going to different clinics. You need to try to stay consistent because this will be the most effective way that you can receive treatment, whether it's for you having actual HIV or for going through your prophylaxis preventative treatment. So you can become HIV undetectable in a minimum of 8 weeks if you start the ART. So basically, whenever you get tested after 8 weeks of starting the medication, your viral load will be so low that it'll be quote unquote undetectable. But that doesn't mean that you shouldn't not treat yourself as you have HIV. You still need to be responsible and make sure that you tell your partners that you are positive for HIV, because there is still always a small chance that you could go ahead and pass that on. So take responsibility, knowing status of your partners and practicing safe sex. And so still wear condoms and whatnot, because you could possibly transmit HIV. Make sure that you take care of yourself and your health, and use your medication as prescribed to reduce that viral load. Some medications are Biktarvy, Simutsa, Delstrigo, Zidovudine, which is taken during pregnancy, and Colectra for children who have HIV. Okay, so this is just a this just kind of groups the medications and what they do. So we do have a couple groups, depending on how advanced your HIV is or what your doctor thinks is the best treatment. This is how the medication is going to reduce that viral load. So for example, non-nucleoside reverse transcriptase inhibitors, they're going to turn off a protein needed for HIV to make copies of itself. And integrase inhibitors, for example, will go ahead and block protein and integrase, preventing HIV from inserting itself in CD4 T cells. So basically, HIV infects your CD4 T cells, which are part of your immune system. And they go ahead, and whenever you get infected by another virus, such as the flu or whatever, they'll go ahead and start attacking that virus. So by understanding how these medications work, that's how your HIV will be prevented. Okay. So monitoring HIV, so again, it can monitor your CD4 T cells, which again is what the medication is trying to prevent the virus from infecting. So again, it'll go ahead and detect the viral load. And also, we want to make sure that we are wary about drug resistance prevention by taking medications as prescribed. So it is so important that you take your HIV medication as prescribed, because not only can your viral load increase, but HIV is a little interesting in that it can also create some kind of resistance. So similar to bacteria, this is becoming a problem in HIV as well. So make sure that you are taking your HIV medication responsibly. So all these tests will lead to a proper HIV treatment.
So this is just in summary about what we learned going through the group project. I think the biggest thing is that education that we can give our patients, giving them the proper education about how HIV can and cannot be transmitted. I think there's a lot of information that people think of how it can be transmitted, but that's not actually the case. As well as how to protect themselves from HIV, again, with protection, sexual protection, needles, things like that. And if they are positive, how they can keep themselves healthy, you know, the importance of telling other people and how to protect others as well. The Healthy People 2020, they had 3 primary goals. It was reducing new infections, increasing access to care, and improving health for people that are living with it, and reducing HIV-related disparities and health inequities. So as we said before, you know, 19% of people are unaware that they are positive, so that would want to be increased. 91% of new infections in the US are from people who are not aware of their diagnosis, or it's people who have been diagnosed and are not receiving care. The public perception of the seriousness of HIV has also decreased in recent years, which has caused an increase in risky behavior, such as sharing needles, unprotected sex, things like that. So they're trying to make people more aware with media campaigns and education to reduce that number. And then here is a list of our references. And that is pretty much it.